Everybody's talking about ADHD, so let's jump into it a little bit. My name is Sulmanazizmirzamd. I'm a psychiatrist, board certified in adult and child adolescent psychiatry, so ADHD is my jam. One of the questions that gets brought up is the question of onset. Is there adult onset ADHD? Do people start to develop it over time? The answer to that question is no. It's not that we're developing ADHD, it's more so that the ADHD was there in certain ways and then it showed up during our adulthood. And that's an important thing. When we're kind of going back and we're doing an evaluation of it, we want to create that timeline to show some of these symptoms were probably there in some way or shape or form that we didn't fully recognize. They were hidden, they were masked, there was something along the way that we used them to our advantage. And then in adulthood, when a certain time came when we weren't able to mask them anymore, they showed up and started to impact our life. When we're talking about the DSM-5 that came out back in 2013, one of the things it was a question about the age of onset of ADHD. So it moved the age of onset from 6 to 12 years old. So there was a lot of controversy because people were like, well, now you're going to open the diagnostic criteria a lot more. You're going to have more people who are saying they're ADHD. And I think there's a little bit of understanding is that, again, we were not recognizing what ADHD was, or we were mislabeling it as something else. There are 3 different types of ADHD: inattentive type, hyperactive type, and combined type. So when we're talking about inattentive type, we're talking about people who have trouble with focusing, people who have trouble with completing tasks once they start them, people who procrastinate, people who are daydreaming. Hyperactivity is more kind of the stereotypical thing that we see when we think of, 5-year-old little boys in kindergarten jumping off the wall and unable to sit still, being really fidgety, leaving the room when they're not supposed to, being unable to sit in their seat during the course of the day, climbing trees all the time, always feeling like they're on a go, talking too much. And with this also being impulsive, interrupting other people, having trouble waiting in line. And combined type, self-explanatory. It's the 2 of them together. Children, when we're talking about like under 10 years old and something like that, they tend to fall into that hyperactive and or combined group more so. When we get into adolescence, as we start to kind of grow out of that hyperactive part and become more of the inattentive type. And then adulthood, again, primarily becomes inattentive type ADHD. An important thing also for us to understand is that there's a lot of stigmas that come along with diagnosis and or treatment of this that may prevent people from getting a diagnosis early on in life. One of the things that I see when I'm working as an adult psychiatrist, people will come to me when they're like 20 something years old, early 20s, and then they'll have talked with their parents and the parents will have told them, you were diagnosed with ADHD, but we just didn't want to get you medicine because we didn't believe in it. There's also cultural stuff, racial stuff, regional stuff. One can be a lack of access to somebody who can do an effective and proper diagnosis. In a lot of communities, minority communities, especially Black, brown communities, there is a distrust towards the medical profession because of the atrocities that were done towards them in history, especially in psychiatry. When I did my training in Baltimore City and in Richmond, the word Ritalin, when I was brought up, there was always like a shiver that came from parents because there was, again, the connotations that came along with that were drugging their children, that you're drugging them, you're using this to control them. Adult presentations are going to be different compared to child and adolescent presentations. Again, the most things that we see is more inattentive type symptom. Now, this has a lot of different impacts as we get older and we're not necessarily in grade school anymore. When we're in college, when we're in job, grad school, parenting, all these kind of life transitions that come about, the way that we're supposed to do work, the way that we're supposed to be able to manage work becomes different. So we struggle now, instead with like tests and sitting in classes, with things like deadline. We struggle with jobs and having the freedom and the responsibility that comes with a job, and not having that structure sometimes causes a lot of problems. And then we miss deadlines, we don't respond to emails on time. All these problems kind of show up that can then affect work performance, school performance, grad school performance. Another thing that we talk about is things like financial impact, things like credit scores. This is something that I struggled with back in the day. Is when I had a bill to pay, before the dawn of like auto pay, I would put it in the pile to pay, and then it was gone in that pile, and I'd forget about it. And then when it was time, and over time, this impacted my credit, and I just had no awareness of it because I never monitored it. All of a sudden, then when it was time to like, hey, let's try to get a house, let's try to get a car, something like that, my credit score is like 500 something, and it's like, where did this come from? Because I had no awareness. One of the groups that's been hit really hard by this is women, young women. This feeds into the gender stereotypes that are there. Women aren't supposed to become doctors. Women aren't supposed to become CEOs. Women aren't supposed to become leaders. This then leads to anxiety feelings, feelings of depression, feelings of self-worth kind of being lowered. Again, feeding into these stereotypes that maybe I'm just not meant to do this and I need to take on a lower position or kind of put that glass ceiling in place. A lot of the presentations for young women who come to me is because they've had anxiety, they've had depression, they've had these feelings, and they've tried the medication, treatments for those, and they weren't effective because we're treating the wrong thing. We're not treating the real problem. And when we say, hey, maybe this is ADHD, and we put them on an effective treatment plan, they come back to me a month later and they say, where has this been my whole life? This was life-changing. One of the other issues that pops up is when we have untreated ADHD is the sequelae of it. People will find a way to treat it themselves. And the way that people will do it is through substances. We talk about caffeine, which isn't always problematic until we're drinking 8 cups of coffee a day. Nicotine, alcohol, marijuana. Nicotine is a stimulant. It has an effect where it can slow things down so people are able to concentrate better. Alcohol can slow things down as well. Marijuana can also slow things down as well. There's a caveat as well that we have to talk about. Stimulant medications, which are the first line treatment for ADHD, things like Adderall, things like Ritalin, things along those lines, they're highly effective. They are the most effective medications in psychiatry. This can be misused, and we have the potential for misuse, diversion, manipulation that comes along with these because they work. And they're going to work for a lot of people. We see this all the time with people in high school, colleges. The whole concept of academic doping is that people will sell their medications, share their medications, use their medications in order to do all-nighters, cramming sessions in order to do well on tests. We know that there's Reddit threads. We know that there's all these online forums that exist that people can go to about how to get a diagnosis of ADHD and which doctors are prescribing it. We have the rise of the online prescription mills, things like Cerebral, things like Done, which have been hey, you have ADHD and we're going to give you a medication, a stimulant in order to get this, and you just have to use your phone. Wrapping up, it's important to realize and remember that ADHD is a neurodevelopmental disorder. It's something that has different presentations, it shows up throughout life, and it's really important when we're doing the evaluation to create that timeline, to see what was there, to get that history, talk to collaterals, talk to parents, talk to family members, talk to siblings to see what were some of these things that were potentially there. The impact of ADHD is in multiple facets of life. It can negatively impact women a little bit more because, again, that misdiagnosis. And it's always something that we want to watch out for when we're doing a psychiatric evaluation, when we hear people come to us and say, hey, I've tried everything else and nothing seems to be working and I'm continuing to struggle.